understanding and management of diarrheal disorders in childhood, they are still responsible for major burden of childhood death globally, with estimated 2.5 million deaths. Chronic diarrhea in infants. Common causes: post-infectious secondary lactose deficiency, celiac disease, cow's milk allergy, toddler diarrhea, and infections as giardiasis and HIV, cystic fibrosis. Rare causes: acrodermatitis enteropathica, Hirschsprung disease, primary immune defect, lymphangiectasia, eosinophilic gastroenteritis, intractable diarrheal syndrome, beta-lipoproteinemia, Schwann syndrome, bacterial overgrowth, and other rare causes. Toddler diarrhea, called chronic non-specific diarrhea of childhood, and it is a common problem, occurs to children mainly above 2 years. It is a benign condition, and usually the children have no failure to thrive and usually presented in good nutritional status. Abdominal pain may be present in minority. The stools are foul-smelling, watery, and contain mucus with the undigested vegetable material. The parents are likely to report short mouth to anus transmitted time. Chronic diarrhea in older children.
نعم نعم لحظة بنازل. طبعا هنا الدياريا of infancy هذا بعض الأحيان سيكون الدياريا تسمعون شباب؟
دكتور راح صوتك شوية.
مو هذه الكهرباء انطفت حولت على 3G.
تمام.
نعم. هنا تودر دياريا يا شباب اكو يصير abdominal pain, but this abdominal pain do not interfere with the activity. شوف الطفل فعال ويلعب بالاضافه الى الجيران هيلث مالته, البيلدينج, اليوجوال اكتيفيتيز مالته, بعض الاحيان حتى يعني الذهاب الى السوق, الحركه, اللعب, يعني ما يتاثر نهائيا. just diarrhea. نعم.
Chronic diarrhea in older children. Common causes include post-infectious syndrome, celiac disease, lactose intolerance, infections as giardiasis and HIV, irritable bowel syndrome, and inflammatory bowel disease. Chronic diarrhea in adolescent. Common causes: inflammatory bowel disease, giardiasis, laxative abuse, anorexia nervosa, irritable bowel disease, and constipation with the incorporacies. Rare causes: secretory tumors and Addison disease. How to approach the patients with the chronic diarrhea. History is the most important step, and it is usually make the differential diagnosis now.
دائما يا شباب هو هذا الموضوع الأساس. يعني how to approach the patient with the chronic diarrhea. هذا هو الملخص يختلف الابروتش يختلف عن المحاضرة قد تكون تاخذ بها subject معين, بينما الابروتش يتناول يعني include more than one cause to reach the final diagnosis. يعني مو مثل محاضرة تبديها مثلا عندنا infectious diarrhea وتبدأ. هنا الابروتش هو المهم, شلون توصل إلى المشكلة. تفضل.
And it is also make the differential diagnosis narrow and gives a clue to the cause of the chronic diarrhea. Personal history, age, and it is essential as we explained before. 6. Inflammatory bowel disease in pediatric is common in the male, and ulcerative colitis is more likely to occur in the men, while the Crohn's disease, which is more likely in women. Resident Africa and poor countries suspected infections and HIV. History of a present illness, onset, and each time, which is maybe also indicate some disease or syndromes, and if it is occur before the 6 months of age, it maybe indicate celiac disease. After 1 year, cow's milk allergy or post-infectious diarrhea, which is preceded by gastroenteritis. Course and duration, it is important. Most patients were completely free before this episode. Stool characters is extremely important, and this is to differentiate what we call secretory and osmotic diarrhea. The two types of diarrhea can be differentiated by history, examination, and investigation, and each of this type it will be has its own causes. Osmotic diarrhea can occur when too much of water is down into the bowel, and the most common causes include lactose intolerance, osmotic laxative, and others. While secretory diarrhea it means increase in the active secretions or inhibition of absorption, and most common cause is cholera toxin. Differential diagnosis of osmotic and secretory diarrhea. Sodium in osmotic diarrhea is less than 70 milliequal per liter, while it is more than 70 in secretory diarrhea. pH is less than 5 in osmotic, while it is more than 6 in secretory. Reducing substance is positive in osmotic, while it is negative in secretory diarrhea. And volume less than 200 ml per day, while it is more in osmotic, while it is more than 200 ml per day. And according to response to fasting, diarrhea will stop in osmotic type, while it is continuous and secretory.
طبعا
Associated symptoms.
هذا الجدول يا شباب يشمل انه هذا يشمل clinical and laboratory differences between osmotic and secretory diarrhea. بعض الأحيان يعني ممكن the same organism can cause osmotic وممكن يكون يحتوي على secretory diarrhea. مثلا الكوليرا عادة تسوي لي كمثال secretory diarrhea، لكن بعض الأحيان هي infectious ممكن تسوي osmotic diarrhea، لكن على الأغلب هي secretory diarrhea. فبعض الأحيان infection can cause this or this.
Associated symptoms. If there is no symptoms and the child well, this may be indicate toddler diarrhea. If there is abdominal distension and weakness, it may be indicate celiac disease. Severe abdominal pain, inflammatory bowel disease, bloody diarrhea, inflammatory bowel disease, and if there is vomiting and rash, eosinophilic enteritis, attack of constipation, may be indicate Hirschsprung disease and inflammatory bowel, irritable bowel syndrome, vomiting, weight loss, and behavior change.
ليش ما قلنا البلاد الدياري؟ ليش ما قلنا البلاد الدياري ديزنتري؟ احنا ليش irritable bowel disease؟ ممكن واردة أن يكون باسيلاري يعني شيجلوسيس أو
يعني ممكن تجي دكتور.
ممكن بس احنا ليش يعني هذا هو السؤال مثل التريك بي، يعني هو العنوان مالتنا شنو؟ كرونيك دياريا. واضح؟ كرونيك دياريا ليش اكيوت؟ فاحنا الاكيوت بلاد دياريا with acute تختلف الكوزز بالتاكيد عن البلاد دياريا in case of chronic. لو كان اكيوت كان قلنا ديزنتري، ايكولاي، شيجيلا، انتاميبا، يرسينيا، سيفير ستاف. واضح؟ فهنا على مود يكون الكلام واضح يا شباب، لانه بلاد دياري كاتبين لك inflammatory bowel disease. نعم.
Vomiting, weight loss, and behavior changes, anorexia nervosa. Infant with a severe napkin dermatitis resistance to most treatment, acrodermatitis enteropathica. If there is oral ulcer, this may be indicated inflammatory bowel disease. Non-GIT symptoms, recurrent respiratory tract infections may be indicate cystic fibrosis, weakness, fatigue, and weight loss, inflammatory bowel disease, Addison, and HIV. Skin pigmentation, Addison disease, headache and mood changes, inflammatory bowel syndrome, eczema, cow's milk allergy, and eosinophilic enteritis, joint pain and arthritis, inflammatory bowel disease, generalized lymphadenopathy, HIV, and recurrent fever and weight loss may be indicate TB. Family history and other history. Same illnesses or respiratory problems may be indicate cystic fibrosis, inflammatory bowel disease, or irritable bowel syndrome. Immune deficiency, HIV, traveling abroad, infections, excessive juice intake, and history of previous cardiac operations may be indicated intestinal lymphangiectasia.
هاي الاكسسيف جوس انتيك عادة لو يكونون دولار دياريا. هذه النقطة اكسسيف جوس انتيك ذولا يشربون يعني سواء تحتوي على كربوهيدرات أو الشوجر أكثر من اللازم. هذا يأكلون عادة هو الكين شوجر، هذا الشوجر العادي اللي يزيد لنا الباول موشن. نعم.
نعم دكتور. Diet history. Record a detailed history of feeding prior to the onset of disease and during the disease. It is to provide the vital clues to the etiology like cow's milk protein intolerance, lactose intolerance, gluten enteropathy, soy protein intolerance, and egg protein enteropathy. Overfeeding, concentrating formula feeds more than indicated osmotic diarrhea. Chewing gums and chocolate, plenty of undilated fruit juice like pineapple juice has osmolality of 900 milliosmolality per liter, and apple juice 650 milliosmolality per liter. Stool history. Odorless, blood-tingled stools, shigellosis, frequent mucoid stool in healthy child without blood, inflammatory bowel syndrome. Nocturnal diarrhea is usually associated with the organic disease rather than inflammatory irritable bowel syndrome. Infants having chronic diarrhea with a history of delayed passage of meconium, and if constipation preceded diarrhea,
نعم
Hirschsprung disease.
بعض المرات يا شباب احنا ممكن نسأل السؤال بطريقة ثانية. How the stool killer can help in reaching the differential diagnosis of a chronic diarrhea. هذه كلش مهمة، كلش مهمة. إذا bloody مثل ما قلنا، إذا bloody قد يكون، إذا acute راح يكون shigellosis، إذا chronic inflammatory bowel disease. إذا greasy بالتأكيد، وهذا مال malabsorption نتيجة قد يكون chronic diarrhea post infectious. إذا clay color يعني مثل الطين، هذا قد يكون easy أو large amount foul smell. هذه بعض الأحيان تعطيك hint إنه قد يكون المسألة إنه مال chronic أو مال absorption. نعم.
Drug history. History of laxative abuse, anorexia nervosa, history of a prolonged course of antibiotic may be lead for the pseudomembranous colitis.
أي بالتأكيد هنا الدرج لا نعم الدرج هيستوري هاي بعض الأحيان نسميها infectious diarrhea. الأم ضايجة يعني قد يكون اكو فاميلي بريك داون، وممكن تنطي أكثر من لازكس على مود تروح تدخل المستشفى، أو تنطي يعني ما يخص الدياريا قد تنطي يعني هاي اللاكزاتيف. بعض الأحيان قد يكون يستخدم دروجز غير ذلك، يعني مثلا نعطي انسولين على مود يصير ريبيت هايبوغلايسيميا تدخل مستشفى. احنا نسميه مانشوزن باي بروكسي سيندروم، هذا موجود مانشوزن باي بروكسي سيندروم عند بعض الامهات، تنطي الطفل ادويه على مود تحس انه يكون مريض. زين، فممكن يعني هذه وارده انه اللاكزاتيف بالتاكيد اكو الانفستيجيشن معينه له. نعم.
ريد فلاج.
الريد فلاجز طبعا هنا على مود الاودينس اللي يسمون الريد فلاجز شو تقصدين بيها؟
دكتور يعني warming sign maybe indicate serious disease.
احسنتي يعني هذه العلامات اللي تقول لنا you are in danger. اوكي؟
نعم دكتور.
اوكي دكتور.
Poor weight gain or weight loss, continuous diarrhea, night stool, acid stools may be feel as a burning sensation with a severe inflammation and crying, blood and mucus in stool, failure to thrive, associated symptoms of systemic disease like fever, rash, and arthritis. Examination. Examination has a great role, and this include a general examination. Weight and height should be measured and put on the appropriate charts. Weight loss is seen in many disorders like
بالتأكيد وين بالتأكيد هنا دائما حتى بالامتحانات نسأل من تاخذ هيستوري نسألك سؤال بسيط مثل is your patient thriving well or not؟ إذا هذه من ناحية الإكزامينيشن تاخذ هذه growth parameters اللي تاخذها وتقول لنا إنه my patient thriving well or not according to the chart examination. Okay.
نعم دكتور. Weight loss is seen in many disorders like cystic fibrosis, celiac disease, inflammatory bowel disease. However, weight and height are usually normal in toddler diarrhea. Pallor, this may occur in inflammatory bowel disease, cystic fibrosis, and celiac disease. Fever in inflammatory bowel disease and cystic fibrosis. Clubbing also in inflammatory bowel disease and cystic fibrosis. Ear effusion and adenoid in cystic fibrosis. Oral ulcers in inflammatory bowel disease. Oral oral pigmentation in Addison disease. Perioral rash, acrodermatitis enteropathica. Chest scar, lobectomy scar for cystic fibrosis, and median sternotomy scar for intestinal lymphangiectasia. Signs of bronchiectasis indicate cystic fibrosis, arthritis in inflammatory bowel disease. Characteristic features of celiac disease we'll discuss later. Recurrent infections usually need massive treatment. This may indicate immunodeficiency, like HIV. Investigation. Investigations which can be done in these cases are extremely wide, and investigation are usually depend on history and examination pointed to. However, there are some investigations which are usually done in most cases. This include stool examination, complete blood counts, ESR, and C-reactive protein. Stool examination. Fresh stool samples should be collected and examined. Specific tests should be taken seriously. Occult blood in stool, this may indicate inflammatory bowel disease and cow's milk allergy. While reducing substances may be in carbohydrates malabsorption, maldigested food, and cystic fibrosis, and the stool pH, which is also important. This is beside the routine examination for amoebiasis and giardiasis. Other investigation should be modified according to each case and is depending on the age of the child, most probable causes, and availability of these investigation. خلص الدكتور هسه زينب.
زين تسلمين. فاطمة مو فاطمة؟
سارة دكتور سارة.
سارة أهلا سارة. عاشتي سارة. حقيقة الموضوع انفورماتيف ومجمع بعض الأشياء اللي تغطي أغلب الموضوع. ممتاز. بالتأكيد الانفستيجيشن عند واحد كرونيك دياريا دائما نبدأ بالسمبل تيست النين انفيزيف اللي هي مثلا هي الستول. فالستول عادة ايزي، وكل هذا اللي تفضلت به هو ممكن نحصله، وممكن المسألة تنتهي maybe diagnosed just by stool with history and physical examination. اوكي. وعليكم السلام يا اهلا. زينب يا اهلا زينب.
Malabsorption. Disorder affecting the digestion or absorption of nutrients manifests as abnormal stool, failure to thrive, and specific deficiencies. Malabsorption clinically classified into three basic categories: either selective, as seen in lactose malabsorption, partial, as observed in abetalipoproteinemia, and total, as in celiac disease. Causes. First.
وين زينب؟ يعني احنا لو واحد يعني in general نفتهم المال absorption. مال absorption معناتها هي شنو المال absorption؟
يعني defects بالdigestion والabsorption of يعني either some nutrients أو مثلاً defects بالintestine فيكون يعني هذا اللي هو total.
شباب آسفين. موجودين يا شباب؟
نعم دكتور.
إذن هو المال absorption إذن derangement from the normal absorptive properties of the GIT. أوكي؟ إذن بعض الأحيان نطلق عليه failure of assimilation nutrient by GIT. يعني فشل GIT بالتمثيل الغذائي للمواد الموجودة بداخل القناة الهضمية. Failure of assimilation of the nutrient to be absorbed from the GIT. إذن أنا عندي absorption اللي هو normal process، وعندي malabsorption. بالتأكيد malabsorption معناتها أكو abnormality. تعرفون بالabsorption تماغلين الابزوربشن. الابزوربشن بالتاكيد هو وين يصير؟ بالجي اي تي. هاي الجي اي تي مع الشباب.
نعم دكتور.
زين هذا النت مال على 3G. زين اذا هنا بالابزوربشن بالتاكيد مثل ما قلنا هو بالجي اي تي. الجي اي تي وحدها ما تكفي. اكو axillary glands او axillary organs that help in absorption. اذا كفكره عامه من اقول مال ابزوربشن قد يكون الكوز بالجي اي تي او قد يكون الكوز خارج الجي اي تي تراكت. واضح؟ اوكي.
causes. Next slide. Infective agents, traveler diarrhea, and parasite as Giardia lamblia, or structural defect as inflammatory bowel disease, not irritable, like Crohn disease, or mucosal abnormalities like celiac disease and cow milk intolerance. Enzyme deficiency like lactase deficiency include lactose intolerance, or digestive failure like cystic fibrosis. Carbohydrate intolerance. First, congenital lactase deficiency. It is a rare severe autosomal disorder occurred due to mutation of the lactase fluorescein hydrolase gene, characterized by watery diarrhea, meteorism, and malnutrition, which starts as VUE day after birth by the onset of nursing. While secondary lactose intolerance occur when the gut lining where lactase is produced is damaged, and restored gut function will resolve secondary lactose intolerance. Resolution of symptom within 48 hours of withdrawal of lactose from diet confirmed diagnosis. Investigation, stool exam.
نعم. إذا which one common, secondary or primary lactase deficiency?
Secondary more common.
إذا secondary طبعا هنا أنت الجينيتيك أو الكونجنتال ده rare. هنا بالسكندري ما ذكر rare. زين ما ذكرتي rare بس هي عادة بالتأكيد ما دام ما ذكرتي rare معناته هي more common than genetic. More common than genetic. نعم.
Investigation, stool exam, reducing substance is positive and the stool is acidic, pH less than 5.5. Breath hydrogen test, carbohydrate malabsorption results in bacterial fermentation of the unabsorbed sugar. Those carbohydrate malabsorption can be determined by measuring the exhaled hydrogen concentration after carbohydrate load is administered. Treatment. Secondary lactose intolerance is temporary as long as the gut damage can heal. When the cause of damage to the gut is removed, the gut will heal even if the baby is still fed breast milk or their usual formula. Continuing of breastfeeding or their usual formula will not cause any harm as long as the baby is well and growing normally. Lactase drops such as colic can be added to the baby feed to make digesting the lactose easier. And other is lactose-free formula, but at this type of management, the parent must follow a good dental hygiene because the non-cardiogenic sugar lactose is replaced with cardiogenic glucose. Celiac disease. It is an immune-mediated enteropathy caused by permanent sensitivity to gluten in genetically susceptible individuals, in which proximal small bowel jejunal mucosa is damaged as a result of dietary exposure to gluten. The most common period of presentation is between 6 months and 2 years of age. Celiac disease develop only after
ليش
dietary
ما يصير وين زينب؟ ليش ما يصير بالأول 6 أشهر؟
يعني من يبدي ياخذ
ها شباب؟
العفو دكتور تسمعني؟
اي نعم اسمعكم. ليش ما يصير اول 6 اشهر؟
دكتور بس يعني الملك يكون بالبداية يعني بعدها ما ماخذ يعني دايت ثاني.
احسنت. هي دائما هذا ريليتد للجلوتين دايت. الجلوتين دايت اول 6 اشهر عاده. ماذا لذلك دائما نحن نوصي انه اول 6 اشهر اول 9 اشهر نحاول
شباب تقريبا الوقت خلص، راح أنهي هذا الميتنج وأبلش واحد جديد على ما يجي الدكتور. الله رد مشكلة بالكهرباء.